Anatomy of the colon. The colon and rectum make up the segment of the digestive system commonly refers to as large bowel. Defined as portion of the intestine from IC valve to anus. Large bowel is approximately 150 cm in length. It is divided into 5 segments defined by the vascular supply and the extraperitoneal or retroperitoneal location. Cecum with appendix and ascending colon, transverse colon, descending colon, sigmoid colon, rectum. The anatomy of the rectum will be discussed in chapter 41, and the large bowel has a muscular wall, can be distinguished from the small intestine by its increased diameter, presence of haustra, appendices epiploci, and tinea coli. And the tinea consists of condensation of longitudinal muscle fibers starting near the base of the appendix and continues throughout the abdominal colon to form continuous longitudinal muscle coat in the upper rectum. The haustra are outpouching of the bowel wall separated by folds that give a classic appearance on radiology or barium enema. Right colon is made up of cecum with appendix and ascending colon, and it is anterior to right kidney and duodenum, and its vascular supply is from branches of the superior mesenteric artery. The SMA divides into the middle colic artery and the trunk of SMA. The middle colic artery immediately forms 2 to 3 large arcades in the transverse mesocolon. The SMA ileocolic arterial branches then extend from the SMA. The right colic artery arises as a separate branch from SMA. The right colic artery arises as a separate branch from SMA, that is seen in 10% of the cases. Ileocolic artery gives off a right colic artery to upper ascending colon and forms an anastomosis branches from the middle colic artery. The ileal branch of the ileocolic artery gives off branches to the distal small bowel and cecum, whereas the colic branch supplies the ascending colon. Anastomosis occurs between the distal SMA and the ileal branch of the ileocolic artery at the junction of terminal ileum and cecum. The right colon is retroperitoneal structure. Transverse colon is supplied by the branches of the middle colic artery. It is the first portion of the colon considered to be intraperitoneal. Its length can vary. Its boundaries are defined by the hepatic flexure on the right and the splenic flexure on the left, and both of these points are fixed. The hepatic flexure abuts the gallbladder fossa, while the splenic flexure lies anterior to the splenic hilum and tail of pancreas. The descending colon is where the colon once again becomes a retroperitoneal structure, and it is defined as segment of colon from the splenic flexure to the sigmoid colon. And the descending colon is the first segment of the left side of the colon and receives its blood supply from the inferior mesenteric artery. The inferior mesenteric artery arises from the aorta and gives off the left colic artery. It also gives off 3 to 4 sigmoidal arteries, and which supply the intraperitoneal sigmoid colon. Anastomosis between these vessels of the middle colic artery and those with the left colic artery and the right colic artery is known as the marginal artery of Drummond. The arcade which effectively connects the left and the right circulation is known as the arch of Reulen. The arterial supply to the colon is depicted here. And the venous and lymphatic drainage of the colon parallels the arterial supply. All the 3 vessels course and divide within the colonic mesocolon. Mesocolon contains the regional lymph nodes. For the segment of colon, it supplies and drains. The efferent lymphatic channels pass from the submucosa to the intramuscular subserosal plexus of the bowel to first tier of lymph nodes lying adjacent to the large intestine are known as epicolic nodes. The parabolic nodes lies on the marginal vessels along the mesenteric side of the colon and are frequently involved in metastasis. Intermediate nodes are found along the major arterial branches of the SMA and inferior mesenteric artery in the mesocolon. The principal nodes are found around the origin of the vessels from the aorta and they drain into retroperitoneal nodes. The drainage of superior and inferior mesenteric vein, which drain the ascending transverse, descending and sigmoid colon, is to the portal vein. Rectum is drained by the tributaries to vena cava. The extent of resection of the colon is defined by the vascular supply and by the need to take the regional draining lymph nodes. And careful understanding of the colonic anatomy, structure, location, vascular supply is therefore critical in order to perform safe and effective cancer operation, and the segmental resection important for removal of lesion in various locations within the colon will be described in great detail.